With regards to painful arc syndrome, which of the following statement is true? A. Tenderness is generalized. B. Typically, there is severe pain on initiating abduction. C. The cause is a tear of the supraspinatus tendon. D. If untreated, a frozen shoulder often results. E. Calcification in the region of supraspinatus tendon is not seen on X-ray radiograph. And the answer is D. If untreated, a frozen shoulder often results. Now let's revise a bit regarding painful arc syndrome. Painful arc syndrome, also known as the shoulder impingement. The clinical syndrome is patient presented with pain in the shoulder and upper arm, usually during mid-range glenohumeral abduction, around 60 to 120 degrees of motion. The space between the upper humerus and acromion is compromised. The tendon of rotator cuff is ripped between the greater tuberosity and acromion. Pathogenesis of painful arc syndrome can be divided into 1. Primary impingement, 2. Secondary impingement, 3. Subcoracoid impingement, and 4. Internal impingement. In 1. Primary impingement, it can be further divided into A. Intrinsic impingement and B. Extrinsic impingement. For A. Intrinsic impingement, there is an increased volume of contents of supraspinatus outlet. The structure passing beneath the coracoacromial arch will enlarge and abuts against the arch. There will be thickening of the rotator cuff. Calcium deposition in the cuff and subacromial bursitis occur. This figure illustrates the shoulder impingement caused by shoulder instability. In external impingement, the rotator cuff tendons are compressed by the acromion process. In internal impingement, the structure within the glenohumeral joint themselves are impinged. Both are primarily caused by joint instability. B. For extrinsic impingement, there is decreased space in supraspinatus outlet, subacromial spurring, acromial fracture, or pathological acromial osteophytes of undersurface of acromial joint, exostosis of the greater tuberosity, and type 3 acromion based on Biglini and Morrison classification, which are the causes of extrinsic impingement. The X-ray illustrates a pathological acromial. Number 2. Secondary impingement. There would be normal supraspinatus outlet, glenohumeral instability causing anterior translation of the humeral head. The rotator cuff contacts against the coracoacromial arch. For number 3, subcoracoid impingement. There would be a contact of rotator cuff and coracoid process. The idiopathic cause is due to prominent coracoid. Iatrogenic cause, it can be attributed to coracoid osteotomy procedure. For shoulder instability, we call it trilithite procedure. We can confirm a subcoracoid impingement by doing a Gerben subcoracoid impingement test. How to do it? The arm is flexed at 90 degree, adducted 10 to 20 degree, and the lesser tuberosity will contact with coracoid, and if there is pain elicited, it means impingement. Number 4, internal impingement. The rotator cuff contacts with the posterior superior glenoid usually occur in throwing motion, whereby abducted, extended, and externally rotated shoulder. It is commonly to occur in the throwers who have lost the internal rotation. The center of rotation of the humeral head move upward and the rotator cuff contacts with the bicep tendon attachment. Lastly, regarding the developmental stages of impingement syndrome. For stage 1, there will be an edema and hemorrhage, usually occur in the age less than 25 years old. Usually, we treat with conservative management, that is physiotherapy and NSAIDs. The differential diagnosis include subluxation and acromyoclavicular joint arthritis. In stage 2, there would be fibrosis and tendinitis, usually occur in the age of 25 to 40 years old. There would be a recurrent pain inactivity. The management is by bursectomy or division of coracoacromial ligament. The differential diagnosis include frozen shoulder and calcium deposits. In stage 3, it usually occurs in patients more than 40 years old. There is progressive disability. The management is anterior acromyoplasty, rotator cuff repair. The differential diagnosis include cervical radiculitis, neoplasm. Thank you.